Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Psychiatric mental health nurse practitioner is seeing a patient who presents for complaints of depressive symptoms. The patient reports a history of anhedonia, hopelessness, worthlessness, sleep dysfunction, marked decrease in appetite with an unplanned 5-pound weight loss in the last month, and a marked inability to concentrate on necessary tasks. Before diagnosing the patient with major depressive disorder and beginning antidepressant therapy, the psychiatric mental health nurse practitioner should A. Document a patient health questionnaire 9. B. Administer a mood disorders questionnaire. C. Refer the patient to cognitive behavioral therapy. Or D. Order a TSH and a CBC to rule out physiologic causes. And B is the correct answer. A mood disorders questionnaire will give an indication as to whether or not there is an underlying bipolar disorder, which must be ruled out before antidepressant therapy is started. This is like the cardinal rule of making a diagnosis of major depressive disorder and beginning treatment for it. You have to rule out bipolar disorder first. A is incorrect. The psychiatric mental health nurse practitioner has already established the presence of a minimum of 5 symptoms out of 9 domains, and that's what the PHQ-9 does. You know, of course, the 9 domains of depressive symptoms. These are the domains that we remember by way of the mnemonic SIGI caps, right? There are 9 different domains, and you need to ensure that the patient has symptoms in at least 5 of them all at the same time over a 2-week period. That's like your minimum first step approach to making a diagnosis of a major depressive disorder, and you've already done that. So the PHQ-9 isn't necessary. Now we need to ensure that these depressive symptoms are not due to another cause, and of course bipolar depression is exceedingly important because it's treated differently. C is incorrect. While patients may certainly be referred to psychotherapy if they would like that, it's not required before starting antidepressant therapy. Some patients are good candidates for therapy, some are not. Some prefer to use therapy first, and some prefer not to. It's really, an ancillary question, but it's not like you have to do it before you make a diagnosis and before you start treating people for a depressive disorder. And then finally, a TSH and a CBC might be indicated if there are other indicators of a physiologic problem, but they're certainly not required before starting treatment of a major depressive disorder. It's not like you have to have a CBC and a TSH on the chart before you can make a diagnosis and start treatment with antidepressant therapy. Again, I know I say this, if you've listened to all the podcast questionnaires, you've heard me say it 100 times over. Answer what the question is asking of you. And for anyone who's not really confident in their knowledge base and their thought processes, these other answer choices, they're distractors. That's why we call them distractors. They can distract you off into the wrong tangent. Just be confident in your knowledge base and go back to what it's asking of you. You see a patient with depressive symptoms. You already have assessed anhedonia, hopelessness, worthlessness, sleep dysfunction, a change in appetite, and a weight loss. This patient has 5 of those 9 symptoms, 5 symptoms in 9 domains. So you don't need a patient health questionnaire. And you know that you don't have to refer somebody to cognitive behavioral therapy before beginning antidepressant therapy. You might, but you don't have to. And you also know that you don't have to do a TSH and a CBC before starting antidepressant treatment. But hopefully, one really important foundational principle that you do remember from school is that before beginning antidepressive therapy, you have to rule out bipolar disorder because remember, bipolar depression is treated differently than unipolar depression. Most importantly, it is not treated with an antidepressant. So totally, even if the patient has 5 of 9 symptoms, everything is there, and you really are sure they're having a depressive episode, before you start antidepressant therapy, you do have to rule out that this is bipolar depression. And the Mood Disorders Questionnaire can help you do that. Now, I'm sure that there's a purist that's thinking, well, a Mood Disorders Questionnaire isn't diagnostic. That's true, it's not diagnostic, but it is the one thing here that can point you in the right direction. If the Mood Disorders Questionnaire has a high enough score, then you know you have to consider bipolar disorder, whereas the other 3 answer choices offer you nothing in this circumstance.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.